Hi everyone, this is Sarah McFarland from Inside Scientific, the online environment for life science webinars, virtual events, interviews, and educational content that helps you do your best work. Our Real Science sessions focus on connecting with the researchers, educators, and industry professionals from all walks of life that make scientific discovery and innovation possible. Every year, we run a joint webinar series with the American Physiological Society, and this year's focus is on women's health. So we're very excited to also be partnering with the Society for Women's Health Research. Our next guest on our podcast today is Dr. Licy Yanes Cardozo, Professor of Medicine, Endocrinology, and Pharmacology at the University of Mississippi Medical Center. She's an upcoming speaker in our series who's here to share about her research and why she's passionate about women's health. Licy, thank you so much for being here with us today.
Thank you, Sarah, for having me. I'm excited.
Our pleasure. Okay, so I'm going to jump right in by asking you just to give a really brief summary of your research for us.
Yes. So in my lab and also my clinical research focus on the most common endocrine disorder, which is polycystic ovarian syndrome. So this is a very high prevalent endocrine condition that affect women when they are young, during the reproductive age. So these women, unfortunately, very frequently have a very high prevalence of cardiovascular risk factors such as increases in blood pressure, obesity, insulin resistant, and type 2 diabetes. So in our lab and our research focus on ways to improve the care that we deliver to these women in the clinic.
Awesome. Thank you for that. And such an awesome research program that you've set up there. Really excited for your webinar later this year to talk a little bit more about that, but really love the work coming out of your lab.
That's so kind of you. Thank you so much. Means a lot.
Great. Okay. So our next question here is, how did you become interested in women's health research? Kind of what brought you into this field and what motivates you to continue in this field?
Yes. So I have to take you back to 2002 when I came here to US from South America. I'm originally from Paraguay, and I came to here in Mississippi and joined the Department of Physiology to study sex difference in hypertension and renal disease. So at that time, I clearly realized that there were so many differences. There were similarities too, but difference between male and females rodents, and the mechanisms and the way that they respond to therapy. And then, so I was really fascinated to see such a big difference between male rodents and female rodents. Now, PCOS, polycystic ovarian syndrome, my research really came after, I think the interest came from different sources. So we described an animal model of polycystic ovarian syndrome when I was a postdoc. And then when I moved to my fellowship in endocrinology, I really fell in love with the disease because I realized that there were so many needs in the management of women with PCOS. So many questions that remain to be answered, and is a condition that really deserve a lot of our time and a lot of funding to improve the care that we offer to women with PCOS.
Absolutely, totally agree. I know quite a few women that have been diagnosed with PCOS, and there's not a whole lot of options for them. So I feel like
that's correct.
This is so important to continue.
And I'm sure also you are aware of the struggles that they have to reach to the diagnosis of PCOS. So yeah, I'm sure it wasn't, unfortunately, an easy journey for them. So as I said, it's just, I think it's an area where there are so many opportunities to be involved and to make an impact with our research.
Absolutely.
And I absolutely love, because I see patients in the clinic, so I know what are their concerns, and I can take those to the lab, right, and try to answer those questions as fast and as good as we can with our animal model of PCOS.
Yeah, absolutely. You're in a very unique situation for a lot of your patients to be able to listen to them, take into consideration what they're experiencing, and then also try to address that in the lab
Right.
from the animal model that you've generated to then eventually, hopefully, produce more therapies for people. So that's really great.
That's correct. Thank you.
Okay, next question here. What goals do you have related to your work and the improvement of women's health in your specialty overall?
Yes, I want to make sure that with our research, we make a positive impact in the medical care that we offer to them. So I want to be able to say, we did our best and we contribute to improve what we do with women with PCOS. So I hope that, yeah.
Awesome. I think that's a pretty genuine goal to have. Okay, and kind of following up on that, what are some of the unique challenges that you face when conducting your research?
So one of the things that I realize is that women's have so many roles in the society. So we have one clinical research to study the body composition in women with PCOS. And then when I was talking to one of my patients, she said, I would love to participate, but I work in a daycare. So the daycare opens 6 a.m. And I'm very familiar with daycare, right? Because I have two girls, right? So she said, I work in a daycare, and then it will be very hard for me to miss my job, right? And then so we then I have other participants that they were caregivers, right? I have a patient that was taking care of her mom, her ill mom at home. So she said it's really hard for me to, find someone who will do my work. I have another case of a housekeeping lady that she get paid for hours that she works. So we have so many faces, right? That so we play so many roles in the society. Right? Women are the caregiver, we take care of our parents, our kids, our community, and sometimes it's really hard to find time to even take care of ourselves, right? Because we are so busy taking care of others. So I realized that to one of the things that I think we need to do better is offer more support to women so they can be part of the change and be part of the ability to generate more data. And then we'll need more resources than I think to carry on other type of studies.
Agreed, yeah. I recently became a mom in the last couple years, and it's really difficult to manage working and caring for my daughter and caring for family members, and then also managing your own health.
Yeah.
Becomes
So if
tricky.
exactly, I think the energy. So energy is limit, right? So we have energy to do different things, and I feel like we function to the top of our energy levels, right? So every little thing that is add to it really require a lot of help. So I think that is unique to women's health and to women's research as well.
Absolutely. Absolutely. So driving a little bit away from your research and a little bit more towards public health, in your opinion, how can public health policies better support research and initiatives that aim to improve women's health?
Right. So funding mechanisms are really key, right? As you are aware, there are so many grants that they don't get funded, and if they don't get funded, they're not gonna be done. And so increasing the number of funding opportunities, I think, is really key in all the fields, but maybe especially for women's health, like polycystic ovarian syndrome is better funded now than what it used to be. But because we don't have a lot of data, right? So we really need to do more research, and to do more research, we need more money. So I think saying simple and basically, we do need more money to do research.
Absolutely. You need an increased amount of funding, but then also access to existing funding too, I think.
Correct, to support. And perhaps you need more money, right? So even more money to support women's, right? So they can be able to participate in research, right?
Yeah, absolutely. Amazing. And our last question. Is there anything that you would like the public to better understand about women's health that is often overlooked or misunderstood?
Yeah, that's a great question. So unfortunately, until 1993, most of the research were done in white males. That was the norm, the normal norm, right? Amen. So, and that is, even though it's more than 20 years now, when you look at clinical trials, it's sad to realize that minority and women's, including in that category, are still underrepresented, right? So there is a famous clinical trial that is called EMPA-REG, where a very beneficial drug was studied in patients with heart failure, SGLT2 inhibitor, and only 30% of the participants were women, 70% male. And then when you look at the minorities, African American, only 5%, right? So to really improve care, we need to get data from all of us, right? From all of us. Each of us is different. So I think each of us deserve the best medical care that we can get. And I truly believe that it's through research that we improve medical care and human health in general. So I think we need to get more data. As you know, there are not guidelines that are specific for women. When you go to see your doctor, you are going to be treated the same way that a male will get the treatment. I'm an endocrinologist, so I know that women who have diabetes will suffer from more complications than men. However, when you read the guidelines, there are not really specific guidelines to help us to take care of women. And that is because we don't have a lot of data. That we really need more data to do the guidelines and to improve what we do today.
Yeah, absolutely. And encouraging people to participate in clinical trials, I think, is difficult because we do struggle with, I think, trust between healthcare providers and people who are lending themselves to clinical trials. And I feel like gaining that trust back of the public so that
is
more
so
people
key.
participate.
Yes.
Is more
So
key,
to the population, I will say that I think we all have to work on a legacy in life, right? Life is limited. It's too short for many. So I think getting involved in research is an amazing way to make an impact in your life and others' life, right? Try it. Don't there is a lot of mistrust only because there is a lack of information. We are here to do research and to help humans, right? We just want to help all of us, and you and me and my two girls and your baby. So give us a chance to be part of your story. Give us a chance to make this a better world.
Yeah, absolutely. I love that. Thank you so much today for your time, Licy, and your insights. It was really a pleasure to have you with us, and I hope you had fun.
Thank you so much, Sarah. Truly enjoyed it. Thank you for having me again.
And we hope that you enjoyed this episode of Real Science and that you'll tune in to future episodes where scientists just like you answer questions about their life, their work, and what it's like to be doing real science. Don't forget to subscribe.